All right, I'm gonna do the ABG checkoff here. So on an ABG checkoff, there's some things you want to verify before actually going and doing the ABG. You want to verify the correct FiO2, make sure the patient in the correct FiO2 setting when you go in to make sure that's what it's drawn at. And some physicians want a certain time limit that after they've been placed on a device such as a BiPAP or a vent that say an hour later they wanted it, make sure it's at the appropriate time, that they gave the device long enough to change the values of the ABG. And the next thing is any anticoagulants or thrombolytics to see if you need to hold pressure longer or if you're going to be able to do the ABG procedure without excessive bleeding. Okay, so before entering the room, I'm going to grab everything that I need. Usually a hospital or a place has an actual arterial blood kit that has the heparin syringe, and sometimes they do have, maybe need to switch the needle size, and sometimes they do have the antiseptic, but I actually have a ChloraPrep here, which is mostly used from my experiences to scrub the site before you actually do the procedure. All right, so I got everything ready to go. Now, before I enter the patient's room, I can wash my hands, or if there's a sink in the room, I'll wash my hands there. So say I already washed my hands right before I came in. All right, I'm gonna grab everything, and then I'm gonna knock. All right, hello, I'm Tyler. I'm a respiratory therapist here at the hospital. I'm gonna perform an ABG today. Have you ever had one of those done?
I have them.
Okay, this is just kind of similar to a lab draw that they do on normal blood. I would say this is just a little different. This goes, I'm getting actual blood from your artery, which is the oxygenated blood, and then I can tell by that your oxygen levels to see if your oxygen levels are okay and your carbon dioxide levels are all good. All right, kind of let me get set up here and I'll kind of walk you through it a little more. All right. Okay. If it falls on the ground, throw it away. All right. In this case, I'll do that. All right, so I got everything set up. I already washed my hands, like I said before. I'll wash my hands outside, I promise. You're going to verify some things before you start here. Can I ask you your name, and then you can check the wristband, make sure it correlates. And then another thing is, whatever device they're on, make sure it's set to the correct FiO2 settings, and then you can kind of start. All right, before I start here, are you right-handed or left-handed?
Left-handed.
All right, so I'm going to do a little test to make sure that our arteries are working here. Just going to see your hand. I'll have you make a fist. All right, and then I'll hold the ulnar and the radial arteries just to make sure that their circulation's going here for a couple seconds. All right, and I'll let go, and I'll let you relax. And again, their color came back within 5 seconds, so they passed the test, so I can actually do it on this, and I felt a good pulse. If they would have failed the test and it lasted longer than 5 seconds, you can check the other arm and see, maybe you'd have to do an ABG over there, or distinguish if there was a problem going on. Just notify the nurse and doctor about that. All right, what I'm gonna have you do, I'm gonna have you get into a little position for me here. Most times you'll actually probably do this in a bed, sometimes in a chair. So we don't have a bed here, so we're gonna do it in a chair, and I just place this towel to kind of arc their hand down so it kind of brings the artery more superficial, so it's easier to find. All right, okay. And before I get all this, I'm going to kind of ChloraPrep it here. So I'm not going to open the ChloraPrep, but I'm going to use this, scrub for about 30 seconds, give it some time to actually kill all the bacteria. Okay. All right, so in this kit, kind of gives you everything, and it gives me the heparinized thing, or heparinized syringe here. It's in there to make sure it's not going to coagulate before you get it tested or to the ABG machine that kind of tells you the results. So there's certain needles it comes with. I'm actually not going to use the needle since I'm going to actually kind of act like I'm poking her. We're not going to poke her today. So I would have a needle on the end of this. Okay, so kind of as I do this, I'm going to walk her through the steps. So she's placed good. I've washed her hands. I'm going to refine that pulse. Okay, make sure it is big and kind of hold that vein or the artery to make sure when you go down, it's not going to roll on you. It's going to prevent rolling. So as I go down, I'm going to poke at about a 45-degree angle or so directly over where I think the artery is, and hopefully I find it. So you'll run into some scenarios here. Sometimes you won't find anything and there won't be a flash or anything. In this case, don't try to find it side to side and kind of go around everything. You actually want to bring it up a little bit, but never exit the skin and then go back down. That prevents slicing the artery or slicing any tendons or ligaments within that wrist area. And also, it should be within the second to third fold of the wrist here. So let's say I missed it. I'm going to come back up and try to go down. Say the second scenario, I run into a flash of blood. This just means that you actually went through the artery, so if you just bring it up a little bit, you should have blood flow into the syringe. So say I found it, or blood now, I'm going to get as much as I need. Usually you don't need that much for a machine, maybe half a milliliter or so. So I got it there. I'm going to hold my finger over there and get a gauze pad and bandage. So on this, I'm going to hold 3 to 5 minutes if they're not on any anticoagulants, and until kind of the bleeding stops. I'll check, make sure the bleeding stops. If there are on any anticoagulants, sometimes it'll take up to 10 minutes before the bleeding stops. And on this, you want to make sure it stops so it's not performing anything. Check the puncture site for any changes in color, maybe temperature, swelling, or anything. And just keep holding it. And okay, so let's say the bleeding stopped. I now can cap, and a lot of times right after you use, say I had the needle on, there's usually a safety guard. You want to make sure you pop that right away so you're not have a needle that can be puncture anyone. So I put the safety on the needle, and usually there is a vent or some sort of mechanism that you place on your needle, so when you're actually putting it through, it puts this kind of like solutions in and takes out the air. So let's just put that there and make sure you're never placing that where it could get contaminated. So I'm just going to place it back into this. All right, after they're done bleeding and everything, I'll just kind of let them notify me if there is any bleeding that continues or anything, and then just check on it periodically to make sure that there is no bruising or swelling or anything. All right, well, it looks like I'm all finished. I'm just going to get everything cleaned up here, and we're going to get this ABG test run, and we'll get the results back. So as I'm cleaning up and everything, make sure there's no blood spatters, clean all that up, throw everything away, rewash my hands. Again, just let them know that you'll be back to check on them and with those results. So say I exited the room, I have the syringe. Now there's a couple things. Make sure when you're placing this in, a lot of hospitals have a little machine that you place this in that you actually do, or you send it to lab. Sometimes it'll be ice depending on the amount of time that it's going to be take to run it, but a lot of them that I've noticed, they have machines, so you just make sure there's no air, and you're just going to put it into the machine to get the results. So when you get the results, you're going to record the time you got the results, the FI2 the patient was on, or the name, who took it, which arm it was drawn on, the date, and then once you get the results, this will help you evaluate, do they need more oxygen, less oxygen, how their carbon dioxide levels, so perform, the different therapies needed with the oxygenation. And then the doctor will be able to evaluate kind of further on what is going on with maybe the lungs or the system they had. All right, that is everything.